Good morning, everyone. Bonjour tout le monde. Yesterday, I shared with you that my wife Sophie was being tested for COVID-19, and that test did come back positive. Sophie's symptoms remain mild, but we are following medical advice and taking every precaution. She will remain in isolation for the time being. We are thinking about all the families across the country who've received the same diagnosis. But we're in good hands. We have full confidence in Canada's health officials and professionals. This means that, upon my doctor's recommendation, I will remain in self-isolation for 14 days. I want to be clear, I have no symptoms, and I'm feeling good. And technology allows me to work from home. Of course, it's an inconvenience and somewhat frustrating. We are all social beings, after all. But we have to do this, because we have to protect our neighbors and our friends, especially our more vulnerable seniors and people with pre-existing conditions. We are following medical advice, as should all Canadians. And on that note, I want to thank all of Canada's health professionals and the Public Health Agency who are doing an incredible job supporting and looking after all of us. Hier, je vous ai informé que mon épouse Sophie avait subi un test pour la COVID-19 et le test s'est avéré positif. Les symptômes de Sophie demeurent faibles, mais on suit les recommandations du médecin et on prend toutes les précautions nécessaires. Elle demeurera donc en quarantaine pour une durée indéterminée. Nous pensons à toutes les familles d'un bout à l'autre du pays qui ont reçu le même diagnostic, mais nous sommes entre bonnes mains. Nous avons pleinement confiance dans les professionnels de la santé et les autorités de la santé publique du Canada. Ça veut dire que, suite à la recommandation de mon médecin, je suis en isolement pour 14 jours. Je veux être clair, je n'ai aucun symptôme, je me sens très bien, je travaille de la maison par précaution. De nos jours, la technologie nous permet de travailler à distance. C'est sûr que ce n'est pas idéal et c'est un peu frustrant. Nous sommes, d'après tout, tous des êtres sociaux. Mais c'est ce qu'on doit faire pour protéger nos voisins, nos amis, surtout les personnes âgées, les plus vulnérables et ceux qui souffrent de conditions de santé. Nous suivons l'avis des médecins comme tous les Canadiens devraient faire en ce moment. Je veux en profiter pour remercier tous les professionnels de la santé et l'Agence de santé publique qui font un travail exemplaire pour nous appuyer. Je veux maintenant vous faire part des démarches que le Canada entreprend pour assurer votre sécurité et protéger votre santé. Hier, je me suis entretenu avec plusieurs dirigeants internationaux, dont le président Trump des États-Unis, le premier ministre Johnson du Royaume-Uni et le premier ministre Conte de l'Italie. J'ai également participé à la rencontre du comité spécial du cabinet sur la COVID-19 et j'ai tenu une rencontre téléphonique avec le ministre des Finances sur la situation économique actuelle. J'ai aussi eu la chance de faire le point avec le président et chef de la direction de la Chambre de commerce du Canada et le président du Conseil du travail du Canada. Ce matin, j'ai participé à une rencontre du cabinet et j'ai parlé au président Macron de la France. Mes conversations se poursuivront dans les prochains jours. Plus tôt aujourd'hui, les ministres Blair, Rideau et Garneau ont annoncé que le Canada recommande aux Canadiens d'éviter les voyages non essentiels à l'extérieur du pays. Nous avons également annoncé que la saison des croisières était suspendue jusqu'en juillet et que nous allons rehausser encore davantage les mesures de sécurité dans les aéroports. Nous rationalisons également les arrivées d'outre-mer afin d'être mieux en mesure de les contrôler. Earlier today, Ministers Blair, Rideau and Garneau announced that Canada has advised Canadians to curtail non-essential international travel and that the cruise season is suspended until July and that we are bringing in additional screening measures at airports. We are also streamlining overseas arrivals to be better positioned for screening. Yesterday, we saw many provinces take strong steps to keep people safe. They are doing what needs to be done to protect the public, and I want to thank them for their exemplary work. Later today, I will have a call with the premiers and Indigenous leaders to discuss the latest developments and coordinate our efforts, including the over $1 billion COVID-19 response fund, which provides money to the provinces and territories to support preparation and mitigation. These are significant steps, and we will do more. The provinces and territories are facing various levels of risk, but we will make sure that we align our response across the country. Addressing COVID-19 must be a Team Canada effort. To keep Canadians safe, to mitigate the economic impacts of the virus, all levels of government are working together. We are talking regularly. We are coordinating our efforts. We're following the situation very closely, and we're pulling out all the stops. I know that you're worried. You're worried about your health, about your family's health, about your job, your savings, about paying rent, about the kids not being in school. I know that you're concerned about uncertainty in the global economy. The steps being taken to keep you safe have an economic impact. But what is also true is that we are in the enviable position of having significant fiscal firepower available to support you. This is in addition to the measures we've already taken. The Finance Minister is also in constant communication with his international counterparts to find ways to work together to mitigate the impacts of the virus on the global economy. He will have further announcements shortly this afternoon. The agreement we reached with other parties to suspend the House today also still gives us the flexibility to do the things we need to do in order to support Canadians. No one should have to worry about paying rent, buying groceries, or additional childcare because of COVID-19. We will help Canadians financially. The Government of Canada will be introducing a significant fiscal stimulus package in the days ahead. Le gouvernement du Canada annoncera des mesures de relance fiscale importantes au cours des prochains jours. Je sais que vous êtes nombreux à être inquiets. Inquiets pour votre santé et la santé de votre famille. On fait tout ce qu'on doit faire pour protéger notre économie et nous nous trouvons dans une position fiscale avantageuse. Tous les ordres de gouvernement travaillent ensemble pour freiner la propagation du virus. Les entreprises et les citoyens, comme vous, prennent des précautions. Nous avons ici au Canada des services et des professionnels de la santé incroyables qui font présentement un travail incroyable. Every order of government is working to stop the spread of the virus. Businesses and citizens are taking precautions. We have outstanding public health authorities who are doing an outstanding job. We will get through this together. Merci tout le monde.
Bonjour, M. Trudeau. Louis Blouin de Radio-Canada. Vous avez évoqué des mesures pour limiter le nombre de voyageurs étrangers qui arrivent au Canada. Est-ce que vous pouvez être plus précis, s'il vous plaît? À quoi vous pensez? Est-ce que c'est limiter le nombre de vols? Est-ce que c'est cibler des pays en particulier? Il y a beaucoup de gens qui s'inquiètent peut-être que ça arrive comme ça d'un autre pays. Qu'est-ce que vous voulez faire précisément?
On est en train de travailler sur les mesures précises, mais je peux vous dire qu'on va réduire le nombre d'aéroports qui acceptent des travailleurs outre-mer pour mieux procéder à l'évaluation et au processus qui vont s'assurer de la sécurité des Canadiens. On regarde aussi par rapport aux origines des vols et aux déplacements pour voir s'il y a d'autres étapes à prendre. Et on va continuer de travailler à tous les jours pour s'assurer que les Canadiens soient en sécurité. We are looking to reduce the number of airports that will accept travelers from overseas in order to be able to give the proper resources on all arrivals to ensure that we're doing everything we can to keep Canadians and Canada safe. We're also obviously looking at countries of origin and further measures that we can take. We will make those decisions based on the best science, the best recommendations of our health officials.
Est-ce que ça fait partie de vos options de fermer complètement les frontières à certains pays? Et si oui, quels sont vos critères pour en arriver là? Et là aussi, je vous demanderai d'être précis. Est-ce que c'est un nombre de cas au Canada, un niveau de contamination communautaire, etc.?
Nos critères d'évaluation pour les prochaines décisions sont entièrement basés sur les recommandations des experts et les autorités en santé publique. Nous faisons confiance aux experts ici au Canada et à travers le monde et nous allons suivre leurs recommandations. Nous ne fermons pas la porte à toute prochaine étape. Nous regardons qu'est-ce qu'on peut faire pour continuer à faire le travail que nous faisons depuis des semaines pour garder les Canadiens en sécurité, et ça va continuer. We will continue to make decisions based on recommendations of medical experts, public health authorities, and top scientists. We understand that we have taken significant measures over the past weeks and month to ensure that Canadians are kept safe and to slow the spread of the virus. We will continue to make determinations about how best to do that based on recommendations of experts. We're not closing the door to any further steps, but we will make those decisions based on what science tells us.
Ryan Tumulty, National Post, sir. The financial markets have had two of their worst days on record this week. I'm just wondering, you talk about the government's fiscal power. Why haven't we used it yet, and what are you planning to do?
2 days ago, we announced a $1 billion plan to help invest in health and support Canadians across the country. We've also put forward measures that will strengthen EI and help Canadians. We recognize there is much more to do. We do not want any Canadian to have to worry about whether or not they're going to be able to pay their rent, whether or not they're going to be able to buy groceries or care for their kids, or elderly family members. We need to make sure that Canadians have the options and the ability to follow the best public health advice and keep themselves safe. That is what we are focused on, and we will be rolling out those measures in the coming days. The Finance Minister will make further announcements later today on concrete measures to support our economy. But further to that, in my conversations with my fellow G7 leaders, we have agreed that it will be important for us to coordinate at a G7 level to impact the global economy. And we will be continuing to follow up on those conversations in the coming days as well.
Direct financial payments to Canadians or to affected industries?
We are looking at ways to help Canadians directly, yes, particularly vulnerable Canadians who are going to be particularly squeezed if they aren't able to go to work. These are the kinds of things we're focused on. We also know that small businesses may struggle through or will struggle through this period of economic slowdown, of people choosing to stay at home and protect their families. We will look at how to support them so that once we get through this difficult time, our economy and Canadians will continue to prosper. Okay. Nous regardons comment on va aider directement les Canadiens qui seraient dans des situations plus difficiles où l'absence d'un chèque de paye pourrait avoir des conséquences extrêmes sur leur capacité de payer leur loyer, de s'occuper de leurs enfants ou des aînés ou de mettre de la nourriture sur la table. Donc, nous allons prendre des mesures directes pour appuyer les Canadiens qui font face à des difficultés à ce point-là. Nous allons aussi chercher à aider nos petites et moyennes entreprises qui vont faire face à des semaines difficiles pendant qu'on répond à cette menace à la santé publique. Nous allons annoncer des mesures cet après-midi par le ministre des Finances, mais aussi en début de semaine prochaine avec d'autres mesures pour directement aider les Canadiens.
Hello, Prime Minister. Catherine Cullen, CBC News. Obviously, we wish good health to all Canadians. But if you are to fall ill, members of your cabinet, for instance, what is the plan for governing?
We have continued to engage. I've been very busy both yesterday and today. We'll continue to work from home remotely to do the important things that need to be done to keep Canadians safe. We have an exceptional cabinet that is working hard on all these issues as well. We have extraordinary public servants who are working as well. We will continue to do the work that needs to be done to keep Canadians safe while following all directions by our public health officials.
I don't think that indicates whether there's a contingency plan in place if you were to fall sick. I'm also curious why public health officials have told you you don't need to be tested.
First of all, there have always been contingency plans for ministers who are sick or have, or even a prime minister who is fallen ill. We will continue to follow all those correct contingency plans. But as I said, for now, I am continuing to work extremely hard from home. In terms of advice I've gotten from medical professionals, it was explained to me that as long as I do not show any symptoms at all, there is no value in having me tested. Okay. Je suis les indications des experts en santé publique qui expliquent que tant et aussi longtemps que je n'aurai pas du tout de symptômes du coronavirus, ça ne sert à rien de me tester pour le coronavirus.
Mais justement, là-dessus, il y a des Canadiens qui se posent peut-être la question. Vous êtes un homme en forme, on le sait, vous pourriez avoir la COVID-19, mais pas avoir de symptômes du tout. Vous êtes le premier ministre, vous partagez toujours la même maison que Mme Grégoire Trudeau. Pourquoi ne vous faites pas tester systématiquement à tous les jours en tant que premier ministre?
Les conseils des experts et des médecins, c'est que si je ne démontre pas ou je ne ressens aucun symptôme, ça ne sert à rien de me tester.
Madame Grégoire Trudeau, de ce qu'on a compris, est revenue de Londres samedi dernier ou le week-end dernier. Vous avez rencontré plein de gens au cours de la semaine, notamment à Toronto lundi, également à Ottawa toute la semaine. Vous ne craignez pas avoir été un vecteur de transmission cette semaine?
On a parlé de ça justement avec les experts en santé publique et le fait que je n'ai pas de symptômes, je ne démontre aucun symptôme de la COVID, veut dire que selon eux et selon ce qu'on comprend, il n'y a pas de risque pour les gens avec qui j'aurais travaillé pendant cette semaine.
In English, please.
Okay. According to health officials, the fact that I have expressed absolutely no symptoms means that anyone I engaged with throughout this week has not been put at risk.
Marika Walsh with the Globe and Mail. I'm wondering, given the warnings that Canada is now giving about traveling abroad, should Canadians still be traveling between provinces, between cities, given how different the virus is spreading within Canada?
I think people need to make responsible decisions and check with their medical professionals and check their own travel plans in terms of what makes sense for them. I know that Canadians will listen to the advice of experts and make decisions that are appropriate for them and for their family.
And can you describe specifically what your self-isolation means, both for you and your family and your wife? You're outside right now. Is your wife still going outside? Is your family still going outside? What does self-isolation actually mean for your family?
We, as are many Canadians right now, following very carefully the advice that public health professionals are telling us in terms of what we can do and what we shouldn't do.
So what does that mean?
That means I am in isolation, as are my children, and my wife is in quarantine.
Glenn McGregor, CTV News. Prime Minister, in your conversation with President Trump yesterday, was there any discussion about future access of Canadians to cross the U.S. border and should the situation worsen? And also, do you have any concerns, given the U.S. slow response to this, about Americans coming here?
We have been working very closely with our counterparts in the United States to coordinate our efforts at the border and to align our efforts. There is certainly ongoing conversations that will continue to be had as the situation evolves, but I am confident we will continue to be able to work very closely with the Americans to keep people in North America safe, particularly to keep Canadians safe. On that, it is worth noting that it was one piece of good news that comes out of this situation is that the new Nafta has now been fully passed and ratified and is now awaiting royal assent, which should happen very quickly.
Just following on my colleague's question, could you describe your situation domestically here in a little more detail? Is your wife here in this house? Are all 3 kids here? And if so, question a lot of Canadians are dealing with is how are you going to keep them occupied for the next 2 weeks?
Most of the morning, the kids have been doing Lego, and my wife has been on the phone to friends and family. I have been on the phone with President Macron, with Cabinet, with officials and members of my team as we work to keep Canadians safe.
Good afternoon, Prime Minister. Teresa Wright from the Canadian Press. What is your single biggest concern about Canada's preparedness at this point?
My concern is that Canadians continue to follow the directions of public health authorities. We have to be alert and responsible. We don't want to panic, but we don't want to take this too lightly either. Finding that middle ground is always going to be challenging, but I have tremendous confidence that Canadians are going to be able to.
And what are you telling your children about the heightened sense of concern in the country? And also, how are you explaining some of the political decisions that you're making?
We're obviously having some very good conversations with our kids about what's going on, about how not to be overly concerned, but to be a little bit concerned, which is obviously why they are home today with us. We're going to continue to have thoughtful conversations as parents across the country will be having with their kids.
Prime Minister, good afternoon. Bruce Campion-Smith, The Star. Just wondering if you'd walk us through the logic that Canada has not taken the step of restricting international travels. Is that we don't agree with perhaps the science in those countries or the experts in those countries that advocate for such a move?
Different countries will have experts that give them advice that is suitable for their own situation. We have followed the instructions and the advice and the recommendations of our top public health officials. We will recall that in the a number of weeks ago, in the beginnings, there was discussion of whether or not we should entirely close our borders to China the way the United States did. We did not, and we were able to manage it in a way that allowed for control and a non-spread of the virus that gives us confidence that our public health officials are giving us the right recommendations for Canada.
And on the fiscal stimulus package that's coming out, can you just describe how will is that in place of the budget? Is this kind of a series what we could expect now through the end of this crisis?
We are obviously focused primarily on how we are going to get money into the pockets of Canadians who will need it because of this situation. We've had many discussions over the past months about the budget. That work will continue, but our focus right now is on ensuring that Canadians have the resources and the money to not have to stress about rent and about groceries and about childcare and elder care at a time where they're also very worried about their health and their family's health. We will be supporting the economy and Canadians through this time. Notre priorité maintenant demeure la santé et le bien-être des Canadiens. Nous voulons qu'aucun Canadien ne soit préoccupé par la capacité de payer le loyer ou de pouvoir nourrir leurs enfants ou s'occuper des aînés. Nous allons faire tout ce qui est nécessaire pour les aider pendant ces moments difficiles. Évidemment, les réflexions qu'on a depuis des semaines et des mois sur le budget continuent, mais notre emphase va être sur comment aider les Canadiens dans ce moment difficile. Merci tout le monde.
Merci
tout le monde.
Please mark here. Everybody here is
Yes.
on each.
Hello, welcome back to the National Press Theatre. I'm Christy Kirkup, and again, I will be moderating now the questions with the ministers. Thank you for coming back to take questions. I'll turn it over to Mia Rabson from the Canadian Press for the first question, followed by Lena Dibb with La Presse Canadienne.
Hi, I'm just wondering if you can explain why it wasn't until today that you told Canadians not to travel outside of Canada. It was a recommendation made by other provinces earlier this week. It's been a concern that's been raised constantly that this disease is coming into this country from outside. Why did we not tell Canadians until today, don't travel?
Okay, so I'm going to also ask people, please, journalists, if you have a particular person you want to answer the question, please direct it that way. You have a lot of options. And that was public health advice that we heard from Dr. Tam. So I'm now going to turn to our public health advisors.
I think I'll start, and I'll just turn it to Dr. New. This is, for us, a critical time of containment. Right now, as you know, we have had a very good, solid effort at containing the spread of the disease in Canada. But given that there is increased travel happening over the next several weeks, and given that we are at a critical time in terms of keeping our cases down, this is the determination that public health has provided us in terms of advice that is essential in terms of our next steps. So I'll turn it to Dr. New to speak a little bit about the science behind it.
Sorry.
There you go. Okay. As we've been saying several times, at an FPT level, in terms of technical advice, we've been meeting regularly. And so the Special Advisory Committee did meet yesterday. So the Chief Medical Officers of Health of British Columbia and other provinces, we all had a good discussion, and that's why they've come forward with their advice. Ourselves, all of us together, we've been looking at what's been happening around the world. Initially, the outbreak started, as we all know, in China. And therefore, our advice was based on the evidence and the data coming out of China. What's happened recently is that more and more countries have been involved, and just recently, obviously, the WHO has declared a global pandemic. And because of the new information, plus also what's happening with cases in Canada, initially all of the cases were linked to travel from China, and then more recently from Iran and Egypt. But now cases are also being reported in Canada, having had travel to the United States and other countries in Europe. And that's why now we're at the point of changing our advice.
Okay, maybe you can stay at the mic because you might want to take this question as well. I've also heard concerns that we're taking all these precautions now. Schools are closed, people are staying home, all of these events are canceled for now, but that in 3 weeks or 4 weeks or whenever it is that we all emerge, that then we're just going to be back in the same problem that we've had now. Can you address why this taking these precautions now isn't just going to delay it for a month?
You've actually just answered the question for us, because we all are trying to delay what we call the further sort of transmission and what we call the epidemic curve. You've heard this term a number of times, flattening the curve. And so what we're trying to do in Canada is, by slowing the progression of the disease, you avoid having a sudden uptick or a spike of cases that would overload our hospital and healthcare system. By sort of distributing it out over a sort of a longer period of time, as we mentioned earlier, hopefully that also, because of flu season ending, that will also give us increased hospital capacity. And then should we have COVID cases that are serious and need hospitalization, we'll have the capacity in the country to be able to deal with that.
But won't that uptick just happen in 4 weeks or 3 weeks?
No, because right now the big thing that everyone is talking about is social distancing. That is the key measure, and that's something that everyone has a role to play in. To think that it's not just governments, not just the doctors, not just the healthcare system, public health. Every single Canadian has a role to play.
If I could just add about flattening the curve, if you can flatten the curve, what that means is that people get sick at a slower rate. It obviously helps with the crunch in the emergency rooms of people who are severely ill. But what we also know about this illness, and I think it's important to remember, is that most Canadians will experience a mild to moderate version of this illness. So what we're trying to do by flattening the curve is actually protect the most vulnerable, so that the people that do end up the most ill can actually receive the services that they will need to continue breathing and to continue living in the hospital with the support of hospital services. So when we talk about flattening the curve, it's not because we're so worried that everybody will get so sick that they will not be able to function. What we're doing is we're saying, let us do this so that we can actually make that room in the hospital system so that we can protect those most vulnerable people who will need that care.
Ma question est pour le ministre Garneau.
My question is for Minister Garneau, and it has to do with a possible restriction of foreign flights into Canada. When will you decide which airports overseas flights will have to land in? And if we look at what's happening in the U.S., where they closed their borders, will we be following suit? We are currently in discussion with our airports and airlines. There are a number of mechanisms that need to be set up, but we want to do this in a way that it can be set up as quickly as possible. I can't give you a specific time, but we are working to get this done as quickly as possible. So soon we should be able to announce which airports and when. And a question for you, or perhaps Ms. Freeland. Will that be enough for the Americans? We haven't heard any answer from you since last night. You know, the Americans said that they were closing their doors to European flights. Well, here in Canada, we make decisions based on evidence and science and based on what is the best for the safety of Canadians. These are measures that we believe will help because it will concentrate any travelers coming from overseas in a certain small number of airports where there will be sufficient resources to process those passengers. Yes, and when it comes to our relationship with the U.S., I want to be very, very clear. The leader of the U.S. makes decisions on behalf of Americans. Leaders in Canada make decisions for Canadians. Yesterday, many ministers here, as well as the Prime Minister, had very productive and constructive discussions with our American counterparts. The Prime Minister spoke to President Trump. I spoke to Secretary of State Mike Pompeo. Minister Blair spoke with his counterpart, Secretary Wolf. Vince Rigby spoke with the American National Security Council at the White House. And throughout all of these conversations, we underlined repeatedly that we have a very good and very important relationship with the U.S. I want to underline that our American counterparts were open to these discussions, and we did manage to have conversations with all of the most important decision makers. So we have a very open discussion that is ongoing with our important neighbors. And we all, including the Prime Minister, had a good conversation about the measures that we are taking in Canada to control the coronavirus. And we're doing good work here in Canada. I know that our American counterparts understand that. I also want to say that today we received some other important news, which is the ratification of the new Nafta. For us, for Canadians, it's very important, and it's also an important step for the Americans, who are very pleased with this good international trade agreement that we have. That's something that members of all Canadian political parties got done today to help our economy, which is, of course, very important in these difficult times, but also to help Canada's relationship, very important relationship with the U.S. So I want to thank our colleagues from other political parties, as well as our American counterparts who mentioned how important that agreement was for them.
And then we're going to come back to me at the desk.
Thank you. I think this is for Minister Freeland, likely. Those conversations that you had, I'm just wondering what discussions were had about possible border measures at the Canada-U.S. border. Is there any possibility of the border being shut down or of certain border crossings being shut down if certain airports are being restricted?
When it comes to the Canada-U.S. border, what was reaffirmed in all of the discussions all of us had with our American counterparts on both sides of the conversation was how important that border is for both of our countries, for human reasons, for economic reasons. 400,000 people cross that border every day. It's an essential part of the life of all of very many Canadians and very many Americans, and we affirmed that. Now, we have received today public health advice around all international travel, all travel outside of Canada by Canadians, and I think that all of us in Canada need to listen very carefully to that public health advice. You guys heard it just a few minutes ago. The advice is, that we should, all of us, avoid non-essential travel outside of Canada. And
thank you, and I think it's an excellent question. I think what we have to remember is that viruses don't know borders. A border is not going to contain the virus. The borders are important measures, though, for making sure that people have information about what to do when they're in a particular country, should they find themselves ill. In our case, the information we've been providing since we first became aware of the illness was information about what local public health numbers are available in various jurisdictions, so that no matter who is traveling, regardless of whether it's domestic travel or international travel, they have appropriate information to reach out to public health officials. It's really important to remember this, because I think Canadians think that we can stop this at the border, but what we see is a global pandemic, meaning that border measures actually are highly ineffective and in some cases can create harm. And we see that in some of the countries that have the worst expression, who had the tightest borders. If I point to our dear friends in Italy, in fact, they had, as you recall, some very early restrictions on international travel, in fact, shutting down borders. And what they found was an escalation of cases because, of course, borders don't stop travelers. And travelers find other ways into countries. And travelers become less honest about where they've come from, where they're traveling to, what their particular symptoms may be. And so Canada's approach from the very beginning has been to use science and evidence to make these decisions to keep Canadians safe. The reason why we took the measures early on was because the science says that when you provide the screening and the information at the border, especially as you understand how the pandemic is traveling across the globe, you can actually have those conversations with travelers. You can actually follow those travelers depending on the severity of the illness in their particular country, which we have been doing with public health at local public health levels. You can track and actually even consider, and we have, adding mandatory isolation. And that allows you to contain the spread within your country. Now that we see cases in Canada, borders become less important. And the relationship with the United States is going to be critically important so that we can continue that work together. Because we have people with coronavirus in the United States, and we have people with coronavirus in Canada, and undoubtedly we have people with coronavirus in Mexico. And so those conversations as a continent are going to be what continues to keep us safe. Thank you.
Okay, and as a follow-up, I think this is for Prime Minister Blair, Minister Garneau. I wonder if we could get a little more detail about the screening that will happen at airports for arrivals. What will that screening entail? Will it be for all international travelers, and would that also apply to land border crossings with the U.S.?
Yes, as I've indicated, we have quite recently implemented enhanced screening measures at all land, rail, and marine points of entry, which of course are primarily coming from the United States, not exclusively, but primarily. We focus our resources particularly at people who are traveling from high-risk regions, those which have been identified by our public health officials as tier level 3 or tier 3 regions where there's a higher risk of infection in those regions. And for all international travelers, they are subject to screening. If, for example, they have been to one of those high-risk areas, they receive certain information, and if they are in need of further interaction with our public health officials, the referral takes place right at the airport. We also provide those international travelers with additional information should they become symptomatic or feel ill, and they get public health advice at point of entry. I think that's very, very important. And for those individuals as well who may be symptomatic, there's an immediate referral to public health authorities so that they may begin the important process of self-isolation or quarantine as required. And so those steps are being taken. There's a very close coordination taking place today at all of our points of entry, particularly the international ones from affected regions, between our border service agents and public health, and they're in constant communication. A very important part of our responsibility there is screening for those who are at risk, but it's also informational, as the health minister said, providing people with information so that they can take the right steps to keep themselves and their families and their neighbors safe when they return to this country. And at the same time, as we've heard from the public health officials today, Dr. Tam, we are advising people to avoid all unnecessary travel, and particularly to international destinations. And I think it is important to advise not only Canadians as they travel abroad, but for others who would choose to come to Canada, that they avoid unnecessary travel, non-essential travel to this country. And if they do have to come here, they will be subject to significantly enhanced screening. We're consulting with stakeholders and with our authorities across the country, looking at ways in which we can manage this in the most efficient way possible. We know the important work that public health officials are conducting for Canadians right across the country, and we also know that our border security officers, I believe, are doing an outstanding job in providing those services and protecting the best interest of Canadians. We want to make sure that we utilize those resources most efficiently and most effectively for the safety of Canadians.
I'm going to actually ask a question. That was one of the conditions that I put on the table to moderate the press conference today. Dr. New, my question is actually for you. I'm just wondering if you can speak in a little bit, or actually in much detail, about what social distancing looks like, because even among friends and family, I think the whole notion is creating a lot of anxiety for people about, you guys are all kind of huddled on the stage here. So can you describe
two arm lengths?
Yeah. So should people be going to social gatherings? Can you just offer us some concrete and Canadians some concrete guidance on what social distancing should look like? I know no big parties, but what about smaller gatherings of family? People are really wondering about this.
Okay, so going back to the science, the idea behind social distancing and sort of this 2-meter rule is because we know that the main mode of transmission of the virus is through droplets, and if someone is sick and coughing, about the farthest they can cough and have a droplet sort of land on the ground or hopefully not hit someone is about up to 2 meters. And so I think the easy way we've explained it, and other authorities across the country, is sort of 2 arm lengths. So that's about 2 meters. And so if people can sort of, still get together, but maintain that sort of general distance and not be sort of within hugging distance, then I think that's what social distancing is all about. And I think that's why also many public health authorities are also recommending no mass gathering events. And, the number itself, I think, is not that critical. 250 has been put forward, and I think that's reasonable. I think it's just the principle of reinforcing with people that, obviously the government can do what it can in terms of being prescriptive in certain ways, mass gathering events, saying that you cannot hold them. But I think, as you say, common sense for many people, the types of small parties people will have. If you just maintain that as sort of a general rule, and as we said before, maybe no handshakes or hugging or kissing, but maybe just the elbow bump, that I think would be a good way to go forward. And of course, as we said many times before, we can't repeat enough times, wash your hands frequently. If you do become ill, don't go to the party, stay at home, don't go to work, and good cough etiquette. So those things still stand.
And I do have a kind of technical question, and I apologize. I know in public health you normally don't talk about individuals and have their names. Of course, in this case, we are talking about Sophie Grégoire Trudeau because that's been made public that she's tested positive. Mm-hmm. She recently was traveling internationally. She had flown to London. She was with the Prime Minister's mother, Margaret Trudeau. Typically, Health Minister Rideau, in the past you've talked about public health working with the airlines and providing the manifest and contacting people who may have been around a passenger who was later identified to have COVID-19. again, sorry for the personal nature of this question because we know who it is, but is that work underway to try and let other passengers on the flight that she was on know that she indeed tested positive? And also if Margaret Trudeau is in self-isolation as well, if we know about that.
So I think I'll say a few words and then I'll turn it over to Dr. New. But first of all, there is no evidence that someone needs to self-isolate if in fact they have been in contact with someone who is asymptomatic. And so it's important to remember that. That is why the Prime Minister has received that public health advice that he doesn't have to have a test. He is, of course, self-isolating out of a degree of precaution because he has had a close contact with someone who's positive. But should he remain asymptomatic for 14 days, then he will be considered to not have the COVID-19 disease. As well, yes, the description that you're providing is actually what contact tracing looks like. So now what will happen with a positive case, given that our cases are still so low in this country, we still have the public health capacity to do this work. This is also important to remember. Now public health will do the contact tracing for Madame Grégoire Trudeau. They will extensively interview her about who she's been in contact with and who she's spoken with, as well as secure the manifest of the plane to talk to people that were within that 2-meter radius of her, to determine if they are feeling symptomatic and to ask them to take appropriate precautions around self-isolation. And I will turn it to Dr. New if you want to add anything.
I think you said it very well, Minister. Obviously, I don't know the details. We're leaving that to local public health authorities to do that very detailed contact tracing, obviously starting with their interview with the Prime Minister's wife. And so the key point will be to determine who she's been in contact with after she began symptoms. So to me, it's not clear. I don't know personally as to when she began to feel ill. Was it on the flight or was it afterwards? If it was really after the flight, then really the people who are around her on that flight would not be considered at risk. If it was becoming ill on the flight, then obviously the steps would be taken as we've done for other cases. It has been, I think, a point of discussion with the Special Advisory Committee, the usefulness, because to date no cases have been sort of further detected through what we call airplane contact tracing. And so in terms of public health resources, in terms of what is the best use of public health resources, a very focused sort of contact tracing on airplanes versus lots of other things they could or should be doing. That's still something where we're looking at. Obviously, we're looking at the evidence based on the cases we've had so far, and then we'll obviously put our best foot forward and advice in terms of what we should be doing for future cases that might have that sort of air flight component.
Thank you. I'll go to Raymond Filion with TVA, and then Kelsey Johnson with Reuters.
Oui, question peut-être pour M. Garneau. Le premier ministre du Québec,
Question for
M.
Minister
Legault,
Garneau.
aujourd'hui,
Premier
demande au
Legault
fédéral
in
de
Quebec
limiter l'entrée des
is
visiteurs au
asking the
Canada.
federal government to
Je comprends que
limit
ce n'est pas dans vos plans
foreign
à ce
entries into
moment-ci.
Canada, foreign visitors to Canada. Is that part of your plan? We are constantly monitoring the situation. Our priority is the health and well-being of Canadians. So everything is on the table at any given time. We know that the situation is evolving and discussions are ongoing. If at a certain point we decide to take additional measures, of course we will announce them. But, that's something that could happen, but it's not necessarily in our plans. I'll just say we're monitoring the situation. Why is it not part of your plans now? Well, as we've said from the beginning, we are being very well advised by health experts, and we know that they are monitoring the situation on behalf of all Canadians. So we are being guided by what they tell us. That doesn't mean that we're not looking at other options, and we'll just have to see in the coming days what happens. But for the moment, what we've announced are just the measures that we believe to be necessary at this time. Perhaps I can just add a few words. I can't comment on what Premier Legault said, but I work very closely with our provincial and territorial counterparts, including the Chief Medical Officer of Quebec. And we've looked at, what the best targeted measures are. As we've said before, borders don't stop viruses. You could have asymptomatic people crossing the border and then develop symptoms only after they've entered the country. So it's more important to have a well-managed public health system that is able to identify and isolate cases quickly. And so far what we've seen that our system in Canada has been able to do that. And we also need Canadians to be aware of the situation. So if they go abroad and come back, they need to be able to self-monitor. That's very important that they do that for the 14 days after they return to Canada, and then they need to contact local authorities if they do feel sick. Thank you.
My question's actually for you. So, have any labs that are not directly owned by a government sought approval for their laboratory-developed tests? And also, when might Health Canada be able to approve the first test kits as medical devices?
We'll have to get back to you. I'm not a laboratory expert. What I can say is that for lab testing in Canada, as we all know, the initial test was first done by our National Microbiology Laboratory in Canada. They had the sort of first validated assay. And over time, certainly the goal is to basically be able to expand and offer lab testing throughout the country. And so by experience, one by one, the provinces, I think first British Columbia and Ontario, because of their experience, have what we now call a validated assay. So that's at the provincial level. And now Alberta has joined them, and Quebec as well. And so in terms of other laboratories, certainly they can use certain testing methodologies, obviously approved by Health Canada, our colleagues who regulate this. But in terms of the final confirmation, it still has to be done by one of the laboratories that has what we call a validated assay. So at this point, it is the laboratories in Quebec, British Columbia, Alberta, and Ontario.
On health kits?
Thank you that we have to wrap this up.
Sorry,
but
I have to. Someone has to go for a call with the Premier.
I'm just on the health kits part. Is Health Canada? Do you know when we might be approving the first test kits as medical devices?
I can't speak to that. I'm not with Health Canada. I'm with the Public Health Agency of Canada. Certainly, we can get back to you with further information in terms of test kits that you said that might be submitted for approval.
And then just as my follow-up, it's not clear to me right now, does Canada consider the United States as a high-risk country for transmission of COVID-19?
I can take that. We are considering all travel outside of Canada to be considered high risk for Canadians right now for two reasons. One, the spread of the illness is quite extensive around the globe. There are countries that are testing extensively and have an understanding of their spread. There are countries that don't have the capacity, as I said in the early days, to survey their population or test for the illness. The second reason that it's high risk to travel outside of Canada right now is because we don't know what is happening in terms of other people's measures. We can see that countries are taking rapid measures very quickly without informing international partners, which puts Canadians at risk of being trapped in a country for potentially 2 weeks or longer, depending on the measures that countries take. And so, out of an abundance of caution, as we've said before, it is best if Canadians stay home. And it is best if they travel domestically, where we are going to be keeping them up to date in terms of our own health status as a country, and in terms of the transparency they've come to expect from us around cases and the growth of cases, and certainly around any kind of regulations that may affect their particular situation. So I'd like to thank all Canadians for the efforts they're making to keep themselves well and to keep their loved ones well. Thank you.
Okay, okay, merci beaucoup.
Thank you. Don't forget your phone. Oh, thanks. I know, I'm sorry. I came in here so quick.